Thanks for joining us today on TrueAlign's webinar. Truly appreciate you guys for showing up, and we hope to show you our new product that we're launching here with Rutherford Dental Lab. My name is Adam Rutherford, and this is my father, Paul. And we're just super excited to be able to bring this TrueAlign to you guys and get going from there. And I have some guests here that are going to help us walk us through the process, and so we can all get started and launch this thing as quickly as possible.
Thanks, Adam. So my name is Michelle Shippy. I work for Full Contour. We're a design center. So we're going to be doing the treatment planning for you guys. So I'm going to share a little bit today about the workflow, how you guys submit a clear aligner case, what types of cases we can take on and treat. And Dr. Bruce is going to go into much more detail on how to be successful with this clear aligner offering.
All right. Thank you, Michelle, Adam, and Paul. I am absolutely delighted to be part of this team. And thank you for trusting me. Been at this aligner game a long time, and I'm very excited for Rutherford Labs to become part of this world. And we're here with them all the way. And we're going to share with you today what we're up to with Rutherford and how we're going to go about this. So my little company is called I Can Do, and it's an acronym for improvement, constant and never ending for dentists in orthodontics. And I love teaching and sharing and especially love helping new providers get going in this aligner world. And so we're going to go through a few slides today. The Rutherford Lab TrueAlign clear aligners is a pretty exciting project, and I think that Adam and Paul are doing the right thing in that they're teaming up with people that have already got proven track records, like Michelle, and therefore not necessarily reinventing the wheel, but instead taking what we already have and just making it that much better. We're partnered with Full Contour by 3Shape, and that is Full Contour's group is headed by Michelle Shippy, as you've just seen, and they'll be doing the clear aligner design, and then Adam and Paul will take it from there. Here they are.
Since 1990, Rutherford Dental Laboratory has been a pillar in the dental community, dedicated to maintaining a complete and modern diagnostic facility, boasting advanced technology and unsurpassed service in order to provide precise and top quality restorations for our doctors and patients. Today, we're announcing the next evolution of our laboratory, TrueAlign. With the patented technology of the aligner consisting of a dual shell and elastomeric middle layer, we're able to manufacture your aligners at savings of 20% or more over the competition. Talk to your patients today about how they can save valuable time and money with faster turnaround times and lower costs using Rutherford Dental Labs TrueAlign. Call us today to get set up.
So exciting, you two. And we go, Paul and Adam. Paul, I want to come up and go for crab's legs with you right away pretty soon. So I'm coming up to Northern California pretty soon. So why are we doing this? We know and love Rutherford Lab, and it's a well-established Crown and Bridge lab. How many years, Paul?
19
years.
1990.
1990. Okay.
Lordy.
Wow.
Yes.
Awesome. Wow. That's amazing. Yes. And of course, you have a wonderful family of docs who love you and trust you. And I've looked at your work, and it's very up to date and digital and amazing with your technology. And of course, you've recognized that there's an incredible demand for clear aligner orthodontics. So I see the two worlds coming together. Someone who already trusts you but wants to get into clear aligners, why not keep it all under one roof at Rutherford Labs? And I think it's brilliant, absolutely. And we'd love to become your clear aligner source out there. How are we doing it? We're going to partner with Full Contour, clear aligners design company in Arizona. And they're experienced, respected, and are excellent to work with. Quality assured due to my oversight. I'm going to be watching and helping out along the way. And my definition of an expert is someone who's made every possible mistake. So I've already figured that out for you two, and therefore won't have you go through that painful process. I'm a board certified orthodontist and a major player in Align Technologies' rise from early 1997 in a strip mall in San Francisco. We sat around and looked at these clear aligners and went, how are we going to move teeth with these things until what it is today? Winning combination, absolutely, for docs and their patients. So what's going to happen is, as usual, with Rutherford, you will select a patient and procure the records. The records will initially be sent to Michelle and to Full Contour through their online portal, which is very intuitive and easy to manage. And they have great service and excellent turnaround times. And they'll have a clinical prediction to you within 72 hours. And you'll be prompted to look at that plan. And that's going to be the limiting factor. So docs, you got to get on this and get going, because you got to know your patients are hot to go. And you will be the limiting factor if you don't get on these plans right away. But Michelle and her company will subtly prompt you along the way.
As will we.
Yes, as will Adam and Paul. And then Rutherford goes ahead with the manufacturing. Seamless, efficient, as in you don't have to be the one who sends the records from Full Contour to Rutherford. That conduit is already in place. So over to you, Michelle. Let's see how this works.
Thank you, Dr. Bruce. So yeah, I just wanted to high level go over the entire workflow so that you're confident in how you get a case submitted, approved, and over to Rutherford for manufacturing. So as Dr. Bruce mentioned, you're going to procure the records. So you're going to take the scans, you're going to get the patient photos and fill out a prescription form, all within the treatment review portal, which is the 3Shape Communicate portal. So you log in, you create a case, you fill out all the information, and you go ahead and submit it. As soon as you submit it, Adam and Paul are going to get that record. They're going to make sure case looks good, they're not missing anything. They're going to accept the case. It's then sent automatically to Full Contour for design. We're going to do our magic within 72 hours or less and get the case back to you, at which time you're going to get an email notification that your case is ready to be reviewed. And also Adam is going to bug you and say, check your case. And so from there, you can log back into the treatment review portal. You're going to get a beautiful 3D viewer along with the movement report. You can look at all of the stages, beginning and end. You can fully manipulate the 3D viewer, get a really good look at the treatment plan. From there, you can either approve the case for manufacturing or you can send it back for modifications. Of course, we want you to be extremely happy with the treatment plan and have full confidence that the plan is going to work well for your patient. So if there's anything you're unhappy with, redesigns are free. Send it back as many times as you need. Obviously, we hope it's perfect the first go around, but we understand orthodontics is very subjective and we want to make sure that you love what you see. So send it back for redesign. It kind of goes in that loop until you're happy with the treatment plan and you click approve. As soon as it's approved, it's sent for manufacturing. Rutherford works their magic and will deliver to you a beautiful aligner case and a branded box that's ready to go to the patient. So what you give and what you get, we kind of went through this briefly, but you're going to give the upper and the lower scans. We always need both scans. Even if we're only treating a single arch, we really need to manage the occlusion and make sure that even if we're just moving one arch, that we're not, messing up with the bite of the patient. And then we're going to need a prescription form. And that just tells us your goals for the patient, right? Are we allowed to perform interproximal reduction? Can we do attachments? Is this a refinement? What does the patient want to see on their case? And then the patient photos are always helpful because when we're looking at just an intraoral scan or an impression scan, we might not know in the scan that the midline is off, but if you have patient photos, we can now see that the midline is off and needs to be adjusted. So patient photos are extremely important in producing a good quality treatment plan. So you're gonna go ahead and upload all that information to the treatment review portal. We'll receive it, we'll do our treatment planning and send you back the 3D viewer and the movement report. And then as soon as you click approve, we deliver all the manufacturing files to Rutherford so that they can go ahead and produce the aligners for you.
You guys, what kind of scans will you accept?
We can accept any scans. Just because you don't have a Trios doesn't mean your scans won't work. So what would happen is you would send your scans how you normally would to us through your iTero or your 3M or Meta, whatever portal it will have, and then we'll go ahead and attach the scans for you. So you don't even need to worry about downloading your STL files and importing it yourself. Just go ahead and send scans as you really would.
The doctor is still responsible for initiating the case. So they go to the treatment review portal, they create a case by filling out the RX and the patient photos, they submit the case, and then they would send their scan to Rutherford through whatever channel they send it through normally, and then Rutherford would go ahead and upload the STLs and accept the case, and then it's sent for treatment planning.
Adam, what if I don't have a scanner?
If you don't have a scanner, then go ahead and send us your models like you normally would, and we have a perfectly good scanner here that we would love to scan for you. So we have all your bases covered, and there's no limit to what we can do.
Perfect. So the clear aligner workflow, as we mentioned, this is kind of repetitive, but I just want to make sure that you guys understand it's super simple. You just submit the case to treatment review. We work our magic. You get an automated email letting you know that your plan is ready to approve. You log into the portal, review the patient, and then approve it, and off it goes to manufacturing. So your job is to create the case and review the case, and that's it.
Yep.
Sounds awesome. All right. So as I mentioned, Rutherford has partnered with some really cool, well-established processes already, and they have chosen the TrueAlign clear aligners. And Adam, I wonder if you can comment a little bit on this, especially the sort of 2 layers and how that works.
So it has this elastomeric middle layer that helps keep tension on the teeth for a longer period of time, and it doesn't wear out over, the 2-week period that each stage is. And it really just helps keep that force on the teeth the entire time for each stage, instead of starting off super strong maybe the first week or the first couple of days, and then kind of tapering off towards the end, where this is kind of more of a consistent force on the tooth the whole time for each stage.
So these aligners are really terrific, and they are able to do a large variety of tooth movements in 3 dimensions, and that's the key to the pre-visualization with full contours setup. So things like inclination, angulation, rotation, extrusion, intrusion, and of course, bodily movement are all available to us with these aligners. And Full Contour fully understands the limitations of the system, and also per aligner what we can get. So we're not guessing here. This is all kind of thought about, and absolutely the setup that is sent to Rutherford from Full Contour will absolutely be possible and attainable. And Rutherford's already done a really nice job, as always, with their packaging, and they're going to come up with a lovely little kit for you, for your patients, and you're going to look like a pro right away with this setup, and that's exciting. Adam, could you also possibly brand it to my office if I wished?
Yes, if you wish, yeah. We can certainly put your logo on it if that's what you would like to see. Yeah, that's basically what your box would look like, exactly how ours does, and just the logo switched around.
Amazing. All right. So I'm going to switch a little bit now, dentists, to a little bit about case selection. And it's one of my sort of soapboxes that I get up on when I'm teaching general dentists about orthodontics. And that is, for goodness sake, it's just like anything, if you're first starting to do endo, you might want to choose, a central incisor with a lovely little well-defined canal, as opposed to the third molar with the 4 accessory canals and a broken file, right? Same thing, implants. You don't want to have your first case as a sinus lift with a hip bone graft and that sort of thing. And the good news is there are millions of clear aligner cases out there that are absolutely fabulous for you and I and Full Contour and Rutherford. And they include things like crowding, spacing, a tiny bit of a midline shift, a bit of an anterior open bite or a deep bite, all those things. And there's so many out there. And the patients will come to you and say, I wore braces as a kid. I didn't wear my retainer, or my wisdom teeth came in and now I can't. And I'm just frustrated. I see myself on Zoom and I see my lower incisors, and it drives me absolutely nuts. So, doc, is there something I can do? And in your mind, you're going to go, boom, oh, Rutherford, yes, they're into this now. Let's think about this. So yes, there's lots of things. that are possible these days with clear aligners. This is absolutely ridiculous. This is a ClinCheck case that was sent to me by one of my dentists that I mentor online. And I kind of went back to her and said, maybe in 36 months, this might sort of work out with 4 to 5 case refinements and an attachment on every tooth that might as well have a bracket on every tooth. Hey, why not send that to your friendly orthodontist and let's cherry pick a few little cases in your office, and you will be healthier and wealthier as well. So, and it's not just the malocclusion that I encourage you to screen in your office. Things like perio, things like bone levels, the quality, the activity, the density, all these things are things that we really want to look at as orthodontic practitioners to make sure that A, we're first doing no harm, and B, that the outcome is going to be possible for that particular patient. So have a look at these things, and this is what differentiates us from the sort of do-it-yourself ortho people who have no clue about any of these things. And that this is our wheelhouse, of course. Also, there's a wide range in this little point, and that is patients' expectations of the outcome differ a great deal depending on their personality. Often, I get people come in, they think Austin Powers has a really nice smile. I get people coming in and they've got a 0.5 millimeter difference between a lateral incisor and a central incisor, and their psychiatrist sent them over to get it fixed. So careful there as well. So be sure that the person's personality and their expectations are in line with what you, A, want to take on, and B, can deliver. And make sure it's all about not just starting, make sure you can finish too. And of course, Full Contour and Rutherford will be on your side with this, but we're, as the practitioner, you're still the gatekeeper as to who you select. And my favorite P word, gosh, yes, some of these cases are possible and maybe even practical, but make sure we keep it profitable as well. And I'll show you how to do that. We put a high value on your mental health as well, for sure. And people come out of the woodwork when it comes to clear aligner orthodontics. I can let you know that. The good news is there are millions of Veronicas out there. Veronica came in, has done everything for her kids already, and says, okay, my turn. I had orthodontics as a kid, and I'm just not happy with my smile. I got some overlap. I've got, I can't get floss in between my lower front teeth. And I feel like my gums are starting to move up a little bit. I'm grinding my teeth at night. Doc, is there something that we can do? And the answer is yes, of course, Veronica, we can, absolutely. And these, as mentioned, there's millions and millions of them out there, and they are in your office. Have your hygienist identify these as they're trying to chip the calculus off their lower incisors and say, hey, this should sure be a lot easier if those teeth were lined up. Why don't we have the doc come in and have a quick look at this and see if there's something that we can do. So of course, Michelle mentioned records are important, and we want to make sure that that all is in place for the orthodontic treatment before we get started. There's always questions about cephalometrics, and I think for us, if you don't have access to cephalometrics, it's not going to be the end of the world because we're not doing a whole lot of anterior-posterior change. But if you get into that eventually, then yes, we do recommend that cephalometric X-ray be part of your records. So away we go. And here's Veronica 4 months later. So really nice alignment. She did a nice job. Each of the aligners were pre-programmed to move the teeth a certain amount. And she wore each of them for 2 weeks. And we got to hear. And Veronica is thrilled, absolutely. And in the meantime, we've done a pretty good job, and we have actually had some fun and even turned a buck on this case as well. And I'll show you what that looks like. So in my world, these cases are, it's up to you, of course, but in around $4,830. The lab cost in total for this case There were 4 months worth of aligners, so that's like about 8, maybe about 9 aligners. The lab cost was $938. A little bit of resin for some attachments. You saw them there. They're about $12 worth of that. And then 6 visits. My accountant is so annoying, and he won't let me forget that every time someone sits in my chair, it costs me about $110 in heat, light, water, staff, PPE, all that sort of stuff. That guy is such a pain. But anyway, $110 every time someone puts their butt in the chair. So that's also a cool thing about clear aligners. We don't have to see our patients quite as much, and we don't have to take up our chair time. And then a set of retainers at the end was $300. So our net, if you take the top line and subtract the other lines, was $2,920 for about, I think there was around 4 or 5 visits in total for Veronica, and our profit was 60%. Or pardon me, 6 visits altogether, including her records appointments. So our profit 60.5%. Not bad, right? Pretty good margins, and it's happy. This is happy dentistry. Nobody dies, and it's the outcomes are always lots of fun and amazing. You can do add-on things like tooth whitening, and it's a gateway for things like cosmetic dentistry, and all kinds of cool conversations that can occur once things line up. And you'll find that people, as their teeth move, they get more and more focused on what's going on in their mouth, and they go, "Oh, doc, by the way, you know that one chipped tooth? Let's get a new edge on that one." I'm pretty excited about this now that things are shaping up. So home runs for clear aligners, class 1. Absolutely try not, especially at first, to take on the class 2s and the class 3s. The key word is the adjective in these sentences, and that is moderate, mild to moderate. That is the spot the sweet spot that we want to stay in, especially as neophyte practitioners. Moderate deep bite, so not buried incisors that are with huge brachycephalic faces and enormous masseter muscles. Just a nice little moderate deep bite, or a moderate open bite, not the one you can throw a dog through, or the tongue is like can't even go anywhere else except into the open bite. In your world, pre-prosthetic and cosmetic, absolutely. And that's why I'm so excited that Rutherford's into this, because they will have, and you will have the full vision. For me, I'm an orthodontist, so I just do the tooth moving part, and then the vision of how the case will finish with the implant or the cosmetic dentistry. I have to be back and forth with the dentist who's going to do that. You will already be able to begin with the absolute end in mind, and that's going to be magic for you in Rutherford Labs for sure. So generally avoid class 2s, class 3s, as I mentioned, severe crowding. And part of this is getting the aligners in around crowded, really, really crowded teeth, and getting them to wrap around these teeth. It's tricky. And sometimes in our world, we actually use braces at first to unravel a severe crowding case before we get into aligners. So things like that, you might want to think about whether or not you're comfortable, especially at first, taking on these kinds of cases. Severe spacing, the ones that we say, up to 3 or 4 millimeters of space, but not all in the same spot, like those big upper central diastemas. They're tough. Very deep bite, or a large open bite. So, and I don't use clear aligners as a first shot at temporomandibular disorders. Yes, in many cases, where occlusion is an issue, they do help, and they act like their own little clenching guards along the way. And of course, Rutherford would help you in the end with one of the retainers becoming a guard as well. So, so yes, we do include cases that have some TMD, but we don't use it sort of as our first line on TMD cases. And try not to avoid surgery. Yes, we do jaw surgery with clear aligners, but if the malocclusion is that crazy, especially at first, we may want to avoid those sorts of things. So once again, lots of great choices out there. Here's Patrick, he's 30, and he's got a few things that are quite manageable for us. He's got some narrowness, he's got some crowding, he's got a little crossbite up front. He's got to be taught which end of the toothbrush to go into his mouth. It's the spoiler alert, it's the fuzzy end that goes in, but we do that a lot at first because, of course, A, getting the records, and B, getting the aligners to fit. We really got to have these people all cleaned up. So it's a great idea to send them to your hygienist first, get them all cleaned up, and then the scan and the aligners will be so much better. So he's a little bit class 3, and you're going to see how we deal with that along the way. The other thing we watch carefully are sizes of lateral incisors. And when Michelle and her team go to set this case up, we're going to see that it's a little bit tricky for them to fit to get the lower incisors to totally line up and still maintain positive overjet. So some of the choices would be either use some rubber bands, which is a possibility eventually, or leave a little bit of space around those laterals and have them widened, or do a bunch of IPR of the lower anteriors. And that conversation can be had with the full contour text as you go back and forth between modification and approval. Narrowness, that's our big thing these days, of course, is to create big, wide, beautiful Meghan Markle type smiles, and the aligners are powerful for that. And of course, on the lower, we don't do a whole lot of actual expansion, but we do what we call a lot of uprighting, which means the bicuspids can sort of stand up taller and therefore increase the amount of arch perimeter that's available for them. Once again, we have a good look and make sure that our building blocks are in good shape, and that we're not going to run into any surprises along the way. And away we go. So this is what the smile summary looks like. The blue things, of course, are the attachments, and Adam and Paul will give you a lovely little template to put these on. And we generally use our composite resin of choice, be it a flowable or we use a lot of 3M's products in my offices, but that's not a product recommendation, just whatever you like. And of course, the templates put them precisely in the right place. And the attachment design is well thought out, and it's customized to each individual tooth movement as well. So full contours gotcha on that. And the software allows you to visualize the initial and the final. And also you can, as you saw, you can kind of run the movie and see what's in between as well. So very, very exciting and fun. And we use this not just for planning our cases, but also as a bit of a marketing thing too. We actually show our patients in advance, hey, this is your teeth. This is where we're going. How exciting is that? And they get pretty cool about that, especially I think in Northern California, the home of all things software. That this is going to be cool for your clients for sure, Adam and Paul. So away we go. Each of them are worn for 2 weeks. People say, oh, how about a crossbite? Do I need anything to separate the bite and that sort of thing? And the answer is really not. Like this tooth will come across the bite nicely without any sort of bite plane and that sort of thing. There's going to be an odd moment when he can't really fit his teeth together anyway, but he'll feel a lot more comfortable with the aligners in his mouth. So that's our secret way of encouraging compliance. You'll notice trim lines. This has been something we've researched very carefully, Michelle and I, and we have determined that the ideal trim line seems to be about the zenith of the gingival margins plus 1 millimeter. That gives us a very, very best grip on these teeth, and fewer attachments as well. So that's exciting stuff. And that, along with Adam's couple of layers of aligner material, I think it's going to make this a very, very exciting system. So here we go. We're getting some alignment going. You're going to see that sometimes we uncover things that we don't fully expect up front. In this case, he's a little more class 3 than we thought he was in the molars. So I'll show you how we deal with that. So in 4 months, he's done a good job. Our job along the way is simply to have them in once in a while, monitor, make sure that things are tracking, that the aligners themselves are very intimate to the teeth and to the attachments. And if that's so, then that means it's working. So it's kind of a no-brainer when it comes to that. Sometimes we do this remotely as well for patients that come from a long distance. We teach them how to use teaspoons to take a mouth selfie and share that with us. If a tooth isn't tracking, it's usually just because there ain't enough room. So what we do is sometimes it's prescribed, sometimes it's not. We'll go in just with a little sandpaper strip and lighten these contacts to give us a little bit more room to have those teeth moving again. The same thing if you see a spontaneous intrusion of a tooth, that's usually because there isn't enough space. Have a look and check and see if some IPR is needed for that. So at 20 aligners, here we are. And yep, we've got alignment within each jaw, but oh, we're kind of edge to edge here. So we're going to add on some little cutouts. And for the second round of aligners, we are going to add in some elastics for him. You can see that he's a little bit class 3 and kind of edge to edge up front. He'd rather not have his upper lateral incisors widened. So we're going to do our best to sort of tuck these teeth back with what he has. But you can see the initial alignment's really, really quite good. He did a good job with his compliance. So here's the idea of adding a few little cutouts. Rutherford will build those in for you, or you can make them yourself on the aligners we use a single hole punch, actually, a paper punch, and just punch them into the aligners. And then he can wear some class 3 elastics. That's going to help us to tuck the lower incisors back a bit more, so we have a bit more room to unravel them without putting him back into underbite. And of course, Isaac Newton helps us here as well, in that there will be a reciprocal movement on the maxilla as well to get an equal and opposite push out of that. So we get from here to here, and we're still sort of a little bit class 3, but the overjet is positive. And this guy's happy. We're going to send him back to his dentist for a little bit of cosmetic recontouring of the anterior teeth. And so from there to there in 32 aligners. So this is, at 2 weeks apiece, that's just over a year, like a year and a bit. And during that time, I might have seen Patrick about 10 times or so altogether. So including the records and the final time that we're together. So you can see what a nice job these aligners do in kind of unfolding these cases and making them wider and more horseshoe shaped, which we truly love. And Patrick's pretty pumped about this and enjoying, getting floss between those teeth and his life being a lot better. As I mentioned, I think in your wheelhouse as a general dentist, a big deal is going to be setting up your cases for pre-cosmetic and pre-prosthetic orthodontics. Here's an example. This is Richard, and he's 30 also. So we get a lot of 30-year-olds around because they finally want to do something for themselves, and they usually have the means by this point in their life to do so. So good try to fit a prosthetic central incisor in there with a little flipper retainer, but just not enough room for an eventual definitive restoration for that tooth. So we're going to actually go ahead and create a better space for an implant replacement. This young gentleman has already had a bone graft, as you can see, with the little fixation screws there, but of course, not enough room to put in a good sized central incisor there. So the cool thing is we can actually have some of the prosthetics going on while we're still moving teeth, as in he can go ahead and have that implant placed and be osseo-integrating even while we're still finishing with the tooth movement. So, and once again, you as the general dentist who's doing all of those things are in the driver's seat and can time this just perfectly as well. So in 7 months, we got him to here. And as you all know, sometimes the space that you create looks enormous, but when you put the calipers to it and look at it apically as well, it's just right. And Adam will tell you that it's way more usual to have not enough space for an implant than too much. And even if we did have a bit too much, and we actually got the implant restoration and the crown in there, and there was a little bit of space on either side, pretty easy just to snug that space up. Much more difficult to try and create some more once you're to that point. So we got some nice alignment as well. People ask about third molars. Should they always go away? The answer is not really, actually. If he's gotten to 30 and his third molars are still happy and healthy up there, we don't have a really great scientific reason to have them removed. We've got a bit more work to be done on that lower left-hand side. And we can do that also with a little bit of interproximal reduction to create a bit more space. And in 12 months, we got Richard to here. And during that time, during the sort of second round of aligners, he had the implant placed as well. So it's in there, it's osseo-integrating. The other cool thing is Adam and Paul will leave you a lovely little pontic space in the aligners. And so patient doesn't have to go, without a tooth. The actual pontic space is filled in with some tooth color material to give us a nice little look while we're finishing up the case. So there's a beautifully placed implant right in the middle. And so we got him from there to there in 12 months. And we got a lot more room now for a lovely permanent restoration. So orthodontics has taken this case from sort of so-so to outstanding. And in a fairly reasonable amount of time, implant is placed, crown is put on top, and I think they did a really nice job with the matching. This is like the actual day the crown went on. So of course, the gingiva was a little bit irritated and that sort of thing. So we got him from there to there in 13 months, and I think really nice service for Richard. And I'm just such a proponent of orthodontics as part of some of these big treatment plans to take them from good to great. And that's why I'm so excited for Rutherford to be a provider of orthodontics. So case selection, there's millions of them out there, and be selective, be picky, and don't feel you have to absolutely treat everything that comes into your office. Really no need. There's people out there like me who bang their head against the wall every single day with these really tough cases. You really don't have to do that. And make sure this case is going to be possible, practical in your particular office and situation and level of comfort. And of course, as mentioned, my favorite P. All right. So Rutherford's going to be a terrific partner of ours, and we're just so excited to have them and Full Contour come together for amazing outcomes. And this is going to make ortho in your offices becoming successful and especially lots of fun. So we mentioned using this not just for treatment planning and visualization, but you can use it as marketing as well. And we do a lot of things on social media and in our office to show people what we've done. We've got a little brag book, both virtual and physical. And these sorts of things you can gather up over time, and people will see themselves in these pictures and go, wow, you can do that for me? That is so cool. Let's get going for sure. So along the way, if you need help, I mentioned I do have a little mentoring system. It's Canadian, so it's iCanDo.ca. And a lady named Carla is on the other end of info@iCanDo.ca. So if you have a case, maybe it's one of your first ones, or maybe it's a little bit outside of that sort of range that we talked about, mild to moderate, but you really, really want to do it. And if it's not your mother-in-law, then send it over, and we will absolutely help you in communication with Michelle and Adam and Paul to make sure that you're successful. I will be the little angel on your shoulder for these cases, and I'm there to provide you with confidence and be assured that you're going to be successful. And I think one of the most important things I do is troubleshooting as well. So you're getting bogged down, things aren't happening as predicted, you're kind of lost, then you've got a little Canadian on the other end who's absolutely going to help you out and get you out of this. So, and we're with you for the whole case if you contract with us for that particular case. So check us out, iCanDo.ca, and we're here to help with you, especially maybe some of your first cases with Full Contour and Rutherford. And of course, my ultimate goal is to have you not need me anymore. So I'm so delighted to be part of this group. And I want to thank Adam and Paul and Michelle for their confidence in me. And you guys, let's get out there, move some teeth.
Let's do it.
Absolutely.
Dr. Bruce, you are so amazing. I always love looking at your cases and your before and afters. And it's like, it just always makes me more excited to do what we do. So thanks for sharing with us. And I think just to end, I always think it's good to just kind of go over some commonly asked questions that we get from practices. So often we get asked, can we do interproximal reduction and attachments on these treatment plans? And the answer is absolutely yes. And in fact, attachments are often required to achieve the results that the patient needs, right? So movements like extrusion, pulling a tooth down, we absolutely have to have an attachment to do that. And what's really great is the software that Full Contour uses helps our treatment planners know when and where to place attachments. There's certain protocols that you can write into the software that says, if you rotate a tooth this much, attachment, or if you're doing extrusion, it puts an attachment, right? So that ensures that you get a predictable treatment plan every single time. On average, with a mild to moderate case, we're looking at 13 to 14 trays per arch, and those are meant to be worn for 2 weeks at a time. However, every patient is a little bit different. So if you have a teenager, their teeth might move really, really quickly and they don't need the full 2 weeks, versus if you have a woman in her 50s, she might need to wear those trays for 3 weeks at a time. So the key is, if the patient goes to switch after 2 weeks and the tray that they're still on is still really tight, they might want to wear it for another week or so. There's no rush. You want to make sure that the teeth have time to move and then settle before moving to the next tray. But of course, if at any point in time during the treatment, the trays stop fitting, or you have a concern, Full Contour offers one free mid-course correction or refinement design. So with clear aligners, we know it is a scientific math equation, basically, to get the software to move the teeth, but sometimes it just doesn't happen in reality in the patient's mouth, right? Medications, patient compliance, age, what types of movements need to happen, all play into whether the plastic can move the teeth in a predictable manner. And so if something goes wrong, we're here to support you guys. You would just take a new scan, submit a new case, and we'll do a free design to get those teeth back on track. So don't be alarmed if you need a mid-course correction or a refinement. It's very normal in the clear aligner world. Adam and Paul, did you want to go over packaging, pricing, anything like that?
We're pretty much coming in at about $80 per stage, about $40 per aligner, and we're coming in at about 20% less than Invisalign, and that's really what we're trying to compete against, and we feel we can save you some significant amount of money doing it that way.
Perfect. And it's good to highlight your guys' turnaround time is really quick, right? The treatment planning takes 3 days or less. Manufacturing, I believe, is 5 days or less.
Yeah.
So we're looking at 8 business days turnaround time, 20% lower cost than Invisalign. It comes in a beautiful package ready to go to the patient. The aligners are crystal clear. You can't even tell the patients are wearing them. It's a great quality plastic. And another selling point I like to talk about is, it doesn't have to be Invisalign or Rutherford aligners. You can have a dual offering in your practice, and the Rutherford aligners allow you to compete with the direct-to-consumers that are coming into the marketplace, selling to your patients with no doctor oversight, and it's messing up their bites. They're getting wide open bites. They can't chew their food, right? And so this allows for you to go after a whole other market that wouldn't be able to afford Invisalign treatment. So you're able to get a new market share at a cheaper price, and obviously that makes your practice more profitable. So it's good to have a dual offering. We're not saying you have to choose one over the other. You can certainly offer both and let the patient decide. And as Paul mentioned, or as Adam mentioned, you can do custom branding on the box too. So if you want to put your practice logo on there, that's something that they can offer, which is really cool. Mm-hmm. Awesome. And then how would a practice sign up with you guys if they wanted to try it out?
Just give us a call. We're here, 925-833-8080. We're here all day, and love to speak with you guys to get started. And then it's just a simple sign up on Full Contour through your email. I'll also put out another video showing you guys how to do exactly how to do it, and it takes no time at all. I have a bunch of videos on YouTube that you guys can check out. It's just Adam Rutherford. Just search it on YouTube, and they'll all be there. And I'll have that video up very shortly after we get done recording the webinar.
Awesome. Okay, well, we're very excited to support you guys and Rutherford Dental Lab. So if you have any questions, reach out to Adam and Paul. They're super excited to get you guys going. And then, of course, if you have any questions, concerns, or need help, Dr. Bruce and I are here to support you guys. Absolutely. Thanks so much for your time.
Thank you guys. Appreciate it.
You.
Have a good day.
Do.
Thank you.
All right.
Bye-bye.
Bye-bye.